Good evening, everyone. My name is Noah with Project Lyme. Thank you for joining us tonight for One Health for Tick-Borne Diseases, Linking Human and Veterinary Medicine. This event is focused on One Health, which is an integrated and unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems. It recognizes the health of all of those individuals are closely linked and interdependent. So the approach mobilizes multiple sectors, disciplines, and communities in order to work together to foster the well-being of those individuals and address things like clean water, energy and air, safe and nutritious food, taking action on climate changes, and contributing to sustainable development. All of this does relate back to tick-borne disease, and our two speakers will discuss that this evening. The first I'll introduce is Cheryl Stroud. She is a DVM PhD. I think that's Doctor of Veterinary Medicine and just a doctor in general. She is the Executive Director of One Health Commission, who's one of our partners for this evening. She's a veterinarian who with a PhD in endocrine physiology and a passion for conveying the urgency of implementing One Health thinking, acting, and decision-making at all levels of academia, research, clinical practice, government, and policy. She has worked in a variety of fields, but has served as the Executive Director of One Health Commission for over 10 years, which is headquartered in DC, or chartered in DC and headquartered in North Carolina. She works with volunteer groups and provides opportunities for individuals and organizations to work together across diverse disciplines to educate about One Health and One Health issues. We also have Laura Kahn, who is an MD, MPH, and MPP and co-founder of the One Health Initiative, the other co-sponsoring organization of this evening's talk. She is the author of Confronting Zoonosis, Linking Human and Veterinary Medicine. For over 20 years, Dr. Kahn has been a research scholar with the Program on Science and Global Security at Princeton School of Public Health and International Affairs at Princeton University. Her education and training encompasses nursing, medicine, public health, and public policy. In 2006, she published Confronting Zoonosis, Linking Human and Veterinary Medicine in the CDC Journal of Emerging Infectious Diseases, which helped launch the One Health Initiative, a global movement promoting the health of all species by increasing communication, collaboration between human, animal, plant, environmental, and ecosystem health professionals. So that was a long introduction to introduce these two lovely ladies that are joining us this evening. I'm going to go ahead and turn it over to Cheryl, who is going to begin the presentation, and you'll see me in a little bit.
Thank you, Noah. How are the slides?
Looking good.
Great. Thank you so much. I bring you greetings from the One Health Commission. As he mentioned, we are a 501c3 that we are based in North Carolina, but work globally to connect One Health stakeholders, to create teams and networks that work together across disciplines to educate about One Health and One Health issues. You're also going to hear from my colleague, Laura, who's with the One Health Initiative. She and I are hoping that we'll be able to share with you some of the many arenas that are in need of One Health. I wish I could see a show of hands as to how many of you already know about One Health. Maybe you can pop in the chat, yes or no, and Noah can tell us later how many of you already are familiar with this movement. We'll give you some examples of needed cross-professional collaborations, and I hope by the end of this hour, you will understand why we feel that it's so important for human health clinicians and veterinary clinicians to work very closely together. So I'm not going to read a long definition. I'm just going to tell you that One Health is a concept, it's an approach, it's a way of thinking and living and decision-making and acting that recognizes that the health of people, animals, and the environment are inextricably interconnected. And this is just a handful of logos of groups and organizations that are working to further this concept. It is a global movement. This is a map that the One Health Commission has been working on since over 10 years that shows organizations around the world, from academia, from government agencies, intergovernmental agencies, nonprofits, for-profits that are embracing and working to further this concept and really make it the default way of doing business at all levels of society. So you're saying that's nice, Cheryl. Why do we need One Health? And I just will have to tell you it's because our systems have forced us into silos. Our academic tenure processes don't necessarily reward working across disciplines. Our government agencies are really in silos. Industry research is proprietary. They don't share data or information. The publication systems, this one really gets me. Most research is done on public dollars, public tax dollars, but it often gets published in association journals that only the members of those associations have access to. Open access is helping us, but we have a long way to go. We have language barriers, not just English, French, Spanish, and German, but discipline language barriers, acronyms that we're not familiar with. And then finally, what we're going to talk about today is this challenge of needing animal and human health clinicians who have a lot to share and learn from each other, finding ways to do that. So I hope that you'll listen today for the One Health difference, how collaborating and transdisciplinary and integrative approaches really help. They benefit patients, they benefit clinicians, and provide overall economic benefits to patients and clinicians and society. So real quick, I hope that the room's filling up. Just real quick, whether you're a patient or a physician, to your knowledge, are there any questions on the patient intake forms asking if patients live, work, or have close contact with animals? In my experience, these questions never show up on the patient intake forms. And are there questions about the patient's home and work environment, and whether it's indoors and outdoors? Do they live or work with animals? So just hold on to those thoughts, because that might be some of the things that we can work toward as we try to really approach vector-borne diseases in a One Health framework. This movement started in the late 90s, coming out of biodiversity and conservation medicine communities, pointing out that so many diseases that humans experience are from animals, which means they're zoonotic diseases, which means they pass between humans and animals very easily. A lot of people don't realize HIV/AIDS started out as a zoonotic disease. Then there were in the early 2000s, there were avian influenza scares. We're in the middle of an avian influenza outbreak right now. It's been jumping into mammals. It's got a lot of us really worried. There was the early coronavirus, SARS-CoV-1 in the early 2000s. We've experienced Ebola and MERS and Nipah and Zika, and now we're just coming out of this pandemic. So zoonotic diseases are definitely a driving factor for One Health, but they're not the only factor. We have discovered, because humans are so human-centric, we think that we're placed in the universe to have dominion over our environment and over our planet, and to use however we want, forgetting that we're really just part of the ecological continuum. And many times our behaviors and our ways of using land and using the environment are causing damage to all the arenas, the animals, the humans, the ecosystems. And we really need to remember how much nature provides us, to protect it, and to realize that biodiversity protects us. And many times people who have experienced vector-borne diseases are afraid to go out in nature. It's really, we've got to find ways to do that safely through education, because we need nature. We really need to be out in nature for our mental health. I often refer to One Health as a ray of hope for the future. So you'll see this slide a couple of times. And as I said, the movement did evolve. It did begin coming out of zoonotic diseases, but we have learned over the past 20 years or so that there are so many arenas that are begging for us to address them and approach them and work together across disciplines in a One Health manner, all the way from animals as sentinels, which we'll be talking about today, to antimicrobial resistance, biodiversity, conservation medicine, climate change, comparative medicine and translational research. Even disaster preparedness needs us to prepare, and response needs us to work in a One Health way. Food safety, water security. I mean, these topics are all so incredibly important in this One Health conversation. And this is just a short list of all the arenas that are begging for this approach. So let's start real quick today with animal sentinels. Some of you will remember in the US here, we had this Flint, Michigan water crisis where lead from pipes was getting into the drinking source. And this is an example of a dog who was having a blood sample drawn to be tested for lead and other metals, copper, mercury, zinc, to see what not only the dog, but the people in that environment had been exposed to, especially the children. So that's one example. Another example is in the 80s, we introduced flame retardants into our environment. And some of those were polybrominated diphenyl ethers, PBDEs. And I came out of vet school in the early 80s. I'm going to age myself a little bit here. And we were not taught anything about hyperthyroid cats when I was in vet school. But in the late 80s, we started diagnosing hyperthyroid cats, and some really smart people at NIEHS had the light bulb moment where, oh, well, maybe these flame retardants in our environment have something to do with the cats that we're now diagnosing. Turns out when they did the research, there was a very, very strong association and high correlation. And even Heather Stapleton here at Duke University in North Carolina did a study of infants and found high polybrominated diphenyl ethers. And we realize now what strong endocrine disruptors these PBDEs are. And that's how the cats were sentinels for this environmental exposure that we were having and that children are having. It's even been postulated that it could be contributing to the childhood obesity pandemic that we're having. A similar story goes for the perfluoroalkyl substances, the PFASs. You may have been following that. CDC has done quite a bit of work on that and has found PFAS everywhere, which is really disturbing because those can also be endocrine disruptors. So animals can show us what we're being exposed to. Now, this sounds a little human-centric, and I don't want you to think that One Health is just about the humans, because we really need to also be paying attention to the inherent value of the animals and the ecosystems and paying attention to their health also. But I'm going to bring forward a few things for you guys to just kind of ruminate on. Another example is the story of how West Nile came into the United States in 1999. I will provide, Noah, I will provide these slides to you afterwards as a PDF, and the links that I've included on all these slides will be active in the PDF. So if anybody wants to go back, I hope they will, and listen to this YouTube video that Dr. Tracy McNamara did, I think you would find it very awakening because she was a veterinary pathologist at the Bronx Zoo in New York in 1999. When people were being diagnosed, they thought, with St. Louis encephalitis, and some were dying. And at the same time, there were crows and other wild birds falling out of the sky dead. And because she was at the zoo and she knew that the flamingos should be very sensitive to St. Louis encephalitis, but they weren't dying, she wanted, maybe these dead crows and the dead people, maybe they're associated. So she managed to get some dead bird samples tested. I think it was an Army lab. And they came to her and said, "You're right, this is not St. Louis encephalitis. This is something we've never seen in this hemisphere. This is West Nile." So the concerning thing about that is it took several weeks to determine what was going on. And she points out so poignantly, at least for here in the US, we have no systems in place surveillance of companion animals and wildlife. So things could emerge out of wildlife or companion animals very easily, and it could take us quite a while to figure it out. A similar thing happened in 2017, also in New York. There was an influenza outbreak in a feline, a cat shelter, and it turned out to be zoonotic. It jumped to the staff there and the veterinarians there. And they had to take precautions, and it took several weeks to figure out what it was. And in that time, they had already adopted out 300 cats. Now, guys, my great-grandfather died in the 1918 flu pandemic. He was late 40s, and he had 13 kids. What if this flu outbreak in New York had been another influenza pandemic, and we had already unleashed it into the community by adopting those cats out? So I urge us to think about how we can pay attention to animals as sentinels in our environment, because there's such an incredible story for us to learn from. Comparative medicine, translational research, many people realize that animals have many of the same tumors and diseases as humans, and if we can find those naturally occurring tumors in animals and do the research to understand them better, we can help the animals and the humans. That's all the time we're going to get on that topic. We could spend hours on each of these topics. The human-animal bond is incredibly important for this conversation. It's so powerful, this emotional support that animals can provide, and we can, it goes both ways. It's good for a human-animal bond. A positive human-animal bond is good for the animals and for the people. And I don't know if you can see this middle bottom image. The sign says, warning, tick-infested area. So many of us sleep with our pets, and just think what's happening if your pets go into the deep grass there and pick up ticks and fleas and then come get in bed with you. So, there are a lot of things for us to be aware of and really cognizant and thinking about. I love to teach One Health with case stories. So this is a true story. It was shared by Robert Miller. He's a veterinarian who used to write a column in the veterinary magazine, Veterinary Medicine. It's a story about his daughter who was a travel writer. So she went off to South America and had a fabulous time, went way up the Amazon, climbed a volcano, and got her story, a really, really good story, and came home. And a couple of weeks later, she was really sick with swollen joints and fever and skin lesions and weird discolored fingernails and shortness of breath. And on radiographs, they found lung lesions. But the most concerning thing they found were like granulomatous visceral lesions or granulomatous lesions in her gut. So to make a very long story short, 2 years, 76 specialists, and 10 CT scans later, they only had tentative diagnoses. They couldn't really put any of the signs together with her travel history. The thing they were most concerned about were those tumors, or those gastrointestinal stromal tumors, and they planned to take her to surgery to find out what it was. Now, about that time, her dad was with some veterinary colleagues, and they told him what was going on with his daughter. And one of them said, well, she probably has a parasite. She needs to take some ivermectin. Another one said she's probably got a vector-borne disease. She needs to take some doxycycline. Well, they sent a blood sample off to Dr. Brightsword at NC State to his intracellular pathogens research lab and found Bartonella vinsonii. Now, some of you will be familiar with Bartonella. I think it's a really emerging pathogen, not that it's a new pathogen to our awareness, but that it's a much more significant pathogen in humans that have previously been appreciated. But to continue our story, the results came back about the time she was headed to surgery. So they went ahead, and after surgery, her dad was in the waiting room, and the surgeon came out and said, we didn't see any sign of malignancy. And her dad said, well, I don't think she has a malignancy. I think she has Bartonellosis. And the surgeon says, I'm a surgeon. I don't know what Bartonellosis is. Now, guys, this is not bad on the surgeon. None of us can know everything. No profession can know everything. But it is an indication that we really need better ways to exchange information across professions. What if the radiologist reading her films had realized that those types of tumors and those types of lesions can be caused by this particular pathogen that was consistent with her travel history. So just another story, and I'll just real quickly mention a partnership between an MD and a veterinarian, not unlike myself and Laura. And so they did a study with some of Dr. Mazziani's patients. He's a rheumatologist, and found that 62% of 296 patients had antibodies to Bartonella henselae or cholerae or vinsonii. And get this, guys, 41% of the patients he sent samples to Dr. Brightsworth's lab on actually had active Bartonella bacteremia that they picked up by PCR. So these kinds of partnerships where we're sharing information and awareness across fields can be very powerful. So let's come to the vector-borne diseases front. And this is where the interconnections of the interconnections, they're just all so closely tied up. This is where climate change is affecting the living locations and geographic disseminations of the ticks and the fleas. And not only the ticks and fleas, but other vectors like sandflies that can vector leishmaniasis. And believe me, guys, we do have some leishmaniasis in the US. We have seen it come in dogs from the Middle East, from from Desert Sand, Desert Storm, from that era with the soldiers over there. We have kissing bugs moving into the US, and they can vector Chagas disease. We're starting to see Chagas disease. And this is one that I'm concerned veterinarians are going to miss, because in dogs it shows up as heart disease. And I don't think we're being taught very much as veterinarians to look for something like that, or even human body lice. But this is where I'd like to share with you some of my veterinary experience, because I was in practice for many years. It was I started out in a large mixed practice and then went to companion animals. And in the 80s and 90s, guys, the only way we could detect heartworms was to take a blood sample and put a drop of blood and look at it under the microscope and look for the little swimmy, squirrely microfilaria or gyrofilaria, or you can think of they're the larva form of the heartworm. Some people think of them as baby heartworms. But in 2001 or so, a wonderful test came to the market. We started using that tested not only for heartworm disease, but also for Lyme, for Borrelia, and also for 3 species of Ehrlichia, and also 2 species of Anaplasma. Now, the really cool thing is that the company that brought this forward, IDEXX, now I'm not promoting IDEXX, I'm just giving you a historic account here of how this all came about. They also offered a discount to veterinary practices that were buying these tests, because they were very well taken up very quickly. I remember when we started using them. If they would report back their SNAP 40X results, and that created a database that IDEXX had of all these tests being from all over the world, which Dr. Khan's going to tell you more of the data and numbers and statistics about. And so in 2009, first in 2002, a really cool thing happened. The Companion Animal Parasite Council was formed as a nonprofit, and a fabulous One Health public-private data sharing partnership emerged, where the data that IDEXX had been gathering was shared with the Companion Animal, or CAPC group, and they were able to geographically map the distribution and the incidence of these positive, seropositive test results on these SNAP tests. So that was really cool. And mostly, I remember being in practice and looking really hard for Lyme positive dogs that were sick. And where I was in Illinois at the time, I would only find positive Lyme, seropositive Lyme tests, but I rarely found a dog that was really sick. And up in Wisconsin, I know that they were telling me that they were finding dogs that were sick. But the data that they were mapping was the seropositivity, not necessarily all the sick dogs. And this is an important point, because the dogs weren't so sick, they weren't getting a whole lot of attention. But then in 2011, CDC was able to pulling from that previous publication that I shared with you, the data, and then overlay it with theirs. And I'm not going to go very deeply into the data here. I'm going to let Dr. Khan do that. But I really would like to point out that in 2012, another publication came out, and it was able to show visually this strong correlation that Dr. Khan's going to talk to us a lot more about. So that was in 2012. And the reason I want to mention this to you is that I'm in North Carolina, and in 2012 in North Carolina, all the human clinicians were basing their awareness of Lyme, and even their diagnoses in some cases of Lyme, of the human maps, because they had these canine seropositivity maps. In 2012, yes, indeed, we had Lyme disease in North Carolina, but the maps that CDC was showing of the diagnoses of people was not showing it in North Carolina. So there was this big controversy and discussion as well as their Lyme disease in North Carolina or not. So this is a critical point for what we're talking about today, and how this can really, it can lay the groundwork for much of what we're talking about today. So with that said, I would like to just give a real quick overview. Why is it so urgent? Because, guys, when we're talking about animals or people, there can be huge benefits to the patients and to the physicians. The physicians will have much more pointed questioning if they're thinking in this broad spectrum, interdisciplinary way. They'll get to diagnoses much quicker. The patients, that means that they'll have shorter times to suffer, less money to spend. I could just hear the ka-ching factor in the story I told you about the young woman travel writer. Will have an overall higher standard of care and overall economic benefits to patients and society. So with that, I would like to thank you for listening to me, and I'll turn it over to Laura. And at this point, Noah, I'm going to stop sharing my screen.
Thank you, Cheryl. Thank you for the broad overview that you gave. And I'm going to kind of pick up where she left off and go into more detail on the human, canine, and spirochete surveillance data. I'm just waiting for Noah to set up my slides. Great. So I'm going to give you go back, a One Health perspective on Lyme and other tick-borne diseases. Next slide, please. Next slide. Oops.
One second. It always does that whenever
Okay.
you do this.
I thought I was protecting against my computer glitches. Okay, great.
All right, perfect.
So you heard a great overview about One Health from Cheryl, and just kind of a recap on that from the One Health Initiative perspective. From my perspective as a human clinician, for me, One Health is very simply the concept that human, animal, plant, environmental, and ecosystem health are linked. And so this concept then provides a very useful framework for examining complex issues such as the zoonotic and vector-borne diseases that we're talking about today. We must examine the root causes of these complex threats if we're to develop effective policies to address them. And I think it's important that we remember that we interact with our environments and ecosystems every day by inhaling air into our lungs, drinking fluids into our GI tracts, ingesting the plants and animals that we call food, and being in nature. And I just want to point out the One Health Initiative website. Please visit it. Next slide, please. So Cheryl talked a lot about the different organizations that recognize One Health, and they have many different ways to visualize the concept, intersecting circles or an all-encompassing umbrella. Next slide, please. But for me, I think of it as a multi-dimensional matrix cube, or a Rubik's Cube, if you will, using different dimensions. Along one dimension, the One Health factors, humans and animals, plants, environments, and ecosystems. Along another dimension, the complexity factors that provide scale at the microbial, cellular, individual, and population levels. And then the political, social, and economic factors that can be represented by political borders at the local, regional, national, and international, global. I'm focusing primarily at the national level here in the United States. Next slide, please. So you can take that cube and smash it down into 2 dimensions, and you can see the intersecting squares, if you will. For me, I define environments as the abiotic, or the soil, water, air aspects of defined geographic areas, and ecosystems as the biotic interactions, the microbial, flora, and fauna interactions within defined geographic areas. Next slide, please. And if you want to learn more about the use of this matrix, I have this paper developing the One Health matrix, and I use that to examine One Health on the global level, tying together antimicrobial resistance, food safety, security, and climate change. Next slide, please. So let's do a brief One Health analysis then, applying it to Lyme disease. Along the One Health factors, we're going to look at humans and animals, specifically dogs, environments and ecosystems. We're going to look at populations. I'm not going to talk about the political, social, and economic factors in this talk. because that's another whole subject that we could spend a long time discussing. And the time factor is going to be in years. Next slide, please. So let's look at a comparative Lyme disease epidemiology between spirochetes, humans, and dogs in the US. And I think it's important that we recognize that while Lyme disease is a global challenge, it's all around the world, it's a particularly severe problem here in the United States. Next slide, please. So now in 2021, this paper, Journal of Medical Entomology, published a paper looking at the reported distribution of Lyme disease spirochetes and the ticks. And so if you look at this map, you can see that the ticks, I. scapularis along the eastern part of the country, I. pacificus along the western side of the country, and then on top of that, you've got Borrelia burgdorferi present in the host-seeking tick species, and by Borrelia burgdorferi and mayoni present also in those species. A large part of the country simply had no records. The data that was collected was from the medical literature as well as from the CDC. But for a lot of it, it's kind of a black box, as Cheryl alluded to in her talk. Next slide, please. So similarly, for human cases, in 2022, the Centers for Disease Control received reports of 63,000 human cases that were reported to the CDC. But they estimate that 476,000 cases were likely treated for Lyme. So a lot of cases are being missed because they're simply not being reported. And also importantly, for parts of the country that physicians do not think Lyme exists because of lack of data, they just don't think about testing their patients because they just don't think, well, that's a risk factor here. You know, with the exception, of course, of the Northeast and the upper Midwest, which are hyper endemic for Lyme, the rest of the country is kind of a black box. Next slide, please. Now, Cheryl talked about the Companion Animal Parasite Council, and this is their forecast for 2024 of canine Lyme disease. And let me get into this a little bit more with the next slide. So this paper that was published in Geospatial Health in 2019 looked at the relationship between human Lyme disease and Borrelia burgdorferi exposure in domestic dogs. Now, they looked at from 2012 to 2016 over 1 million lab tests from dogs that were positive, seropositive for Lyme with a rate of about 6.4%. Now, as Cheryl mentioned, dogs get routinely tested for Lyme, unlike humans. The canine data was aggregated by county and year. And one of their conclusions was that the mean incidence in humans increases with canine seroprevalence until the seroprevalence in dogs reaches about 30%. Next slide, please. So using the canine data, you get a very different picture of compared to the human data. Again, you've got the hyperendemic areas along the Northeast and the upper Midwest, but you see a lot of cases, positive cases in other parts of the country, particularly in the middle of the country that was basically a black box for the human data. So remember, the dogs are getting tested, the humans generally are not. So you can see the different colors based on this legend here, running from 0 to 10% at the hyperendemic regions. Just keep this picture in mind. And this is from 2012 to 2016 aggregate canine Lyme disease data. Next slide, please. So they used mathematical models to then estimate the prevalence of the disease in dogs. And you can see this graph that you saw previously that I showed you. So this is a very different image than what we saw for the human data. You see that in large parts of the country, there is about a 1 to 2.5 or even 2.5 to 5% of prevalence of Lyme. Now, you can argue that dogs are going to get more exposure because they're running through the grass and things like that. But the dogs are telling us that this is in the environment. So never say never to human exposure if we're getting this data in the dogs. Next slide, please. So this is the human Lyme disease incidence data, also from Geospatial Health. Next slide, please. So if we compare the human and canine data, we see the differences in the seroprevalence and the seroprevalence in the canine data, incidence in the human data. We're seeing here that the canine data is providing much more detailed information of what's going on in the environment than what the human data is showing us. And so the dogs are serving as sentinels for us if we choose to pay attention to them and the important information that they're providing to us. Next slide, please. So this CAPC One Health study, again, it's important to recognize that dogs are being tested each year for exposure to these pathogens. And it is up to us to pay attention to this really important data. Next slide, please. So as Cheryl mentioned, the 2011 to 2015 data, the IDEX data that was shared with the CAPC, they found about 50 times more dog cases of Lyme in the South and West than the human cases collected by the CDC, and 25 times more dog cases in the more eastern part of the country. So there's a great discrepancy then between the canine Lyme cases and the human cases. Next slide, please. So they conclude then that there's about 25 times more canine cases than CDC surveillance cases, even though the CDC is acknowledging that they're underestimating the real incidence of Lyme disease in humans by a factor of 10. The discrepancy is quite large. Next slide, please. So again, we have to recognize that dogs are perfect sentinels for us. They live with us, they share our homes, and they're getting a lot more ticks, the tick exposure, and most importantly, getting tested than we are. Next slide, please. So this was the other study that Cheryl had mentioned, the September 2011 published Canine Serology as an Adjunct to Human Lyme Disease Surveillance. Next slide, please. And they found very strong correlation between canine seroprevalence and human Lyme disease incidence with about 0.75, which is extremely strong. As you can see, the correlation is very, very strong. Next slide, please. And this data similarly, this graph as well. Next slide, please. So as Cheryl mentioned, animals have served as sentinels historically. They've literally been the canary in the coal mine to monitor carbon monoxide poisoning. The dancing cats of Minamata Bay, Japan solved the crucial mystery of mercury poisoning, why people and cats were getting sick. Bald eagles getting lead poisoning in the environment. Next slide, please. The West Nile virus story that Cheryl mentioned in 1999. Prairie dogs, the monkeypox outbreak of 2003. And of course, as Cheryl mentioned, the wild waterfowl H5N1 avian influenza outbreak in China in 1996. And that virus is ongoing and causing increasing problems for us. Next slide, please. So let's change gears a little bit and talk about environments and ecosystems and how they influence or appear to influence Lyme disease incidence. Next slide, please. This study looked at the human system feedbacks and the ecology of Lyme disease. This was published in 2018 in the Journal of Applied Ecology. Looking at forest fragmentation and Lyme disease incidence, they found that the more fragmented the forest, the higher the incidence, and why might that be? Next slide, please. Well, if you look at the forest fragmentation, it influences the ecology between the ticks and the potential animal hosts, whether it's deer or mice, the humans and their exposure, and let's not forget the dogs. But this paper just looked at human Lyme disease incidence. Next slide, please. And it's very important to acknowledge the role of biodiversity, or the lack thereof, and risk for Lyme disease, because the less biodiverse the ecology, the greater the risk of Lyme disease. Now, why might that be? Next slide, please. So this paper was very interesting. Why is Lyme disease common in the northern US, but relatively rare in the South? And they examined the roles of the animal host seeking behavior, and tick density. Next slide. So what's very interesting is that mice are extremely competent reservoir hosts for the Lyme disease parasite, Borrelia, the microbe Borrelia burgdorferi, extremely competent. And as you go down the list of reservoir competence, you see that skinks and other reptiles are actually very poor reservoir competent hosts. So mice and other rodents, very competent hosts, skinks and other lizards and reptiles, incompetent hosts. Next slide, please. So interestingly enough, the more fragmented the forest, the better off mice are. Mice happen to love fragmented forests, and their density goes up, they survive well, and so you've now got the interaction between the fragmented forests, the mice, the humans, and the dogs. So there's a One Health picture for you, telling us what's going on. Next slide, please. So in other words, one strategy would be to replace the mice with the skinks, because skinks are primarily in the southern part of the country, where it's less Lyme disease prevalence. The mice are and they're poor reservoir hosts. Mice are in the area where it's hyperendemic, because they are the best reservoir hosts. Next slide, please. So then, to sum up then, our findings from this One Health analysis: Lyme disease causing spirochetes exist around the country, particularly in the Northeast and Midwest. Canine Lyme disease cases reflects this distribution better than human cases. More canine Lyme disease cases than human cases are diagnosed, particularly in the South and West. Historically, animal health has served as an important sentinel for environmental and human health. And so I would argue that canine Lyme disease surveillance data should be an important adjunct to human Lyme disease surveillance data. Biodiversity and forest fragmentation are important risk factors for Lyme disease. The less biodiversity, the greater the risk. The more fragmentation, the greater the risk. And that's because white-footed mice are extremely competent hosts for the spirochete, and they thrive in fragmented forests. Skinks and other lizards are very poor hosts for the spirochete, and they predominate in the South. So a One Health approach then integrates looking across all these different aspects and tells us what's going on. Next slide, please. So One Health, as Cheryl said, recognizes the interconnections of life. Canine Lyme disease incidence data might be useful for improving our knowledge about human disease risk. We should think about better land use policies, trying to avoid forest fragmentation moving forward as we try to figure out how to address this worsening problem as climate change gets worse as well, to reduce the environmental and ecological conditions promoting the spread of these infected ticks. Public policy must be interdisciplinary using a One Health approach. And I encourage everyone, if you're not familiar with the One Health concept, to learn about it at the microbial, individual, and population levels. Next slide, please. So I'd just like to acknowledge my colleagues in the One Health Initiative. This is our team. Next slide, please. And I'd like to thank you all for your time and attention, and we're happy to take any questions, me and Cheryl. Thank you for your attention.
Thank you both for an amazing presentation. A lot of what you spoke about regarding the canine maps we have shared via blogs before, and everybody finds it extremely interesting and relevant because there are so many dog people out there that have been impacted as a result of their pet bringing in a tick that was unknown or something like that. So we're going to go ahead and open up to questions. The first one is from the Cambridge University Press. The reason they reached out with the question is they recently came out with a new open access journal called Research Directions One Health. And they felt that this question, which is one of their main pillars, was relevant to the presentation. I know you both briefly discussed it, but I'll tee it up here. And that what is the current and expected evolution of prevalence, geographical spread, and impact of ticks and tick-borne diseases? That's part one. And part two is what strategies are needed to improve management, testing, diagnosis, and treatment of these diseases amongst patients and animal populations. So I'll go ahead and leave it open there for either of you to address. Feel free to jump in.
Who wants to go first? You want to go first?
Sure. This kind of answers it, Noah. I would like Laura, if she would, to explain what she means by forest fragmentation. I've heard her talk in the past about what that looks like on an everyday, and we're seeing it every day right here in North Carolina. There's so much development. They go in, they bulldoze the landscape, they take all the natural environment out. They might leave a few little trees here. Well, that's a fragmented environment, and that's where the mice love, but you've eliminated the environment for the natural predators. So
right, that's right. There's not enough land for natural predators like owls and other raptors or small carnivores. So the mice, they thrive, and it's wreaking havoc. It's just an unnatural ecosystem, and we're suffering with the consequences of these tick-borne diseases. So that's what I mean by. I mean, it's our development of, suburbia, if you will. These little fragmented microforests it's pretty, but if you decide to go hiking through it, you're putting yourself at risk. So the question then is, how do we address that? Because we've got suburbia developed. How do we move forward? And that's a political question. It's a political, economic, social question. That's another whole subject that is worth talking about moving forward. Because if we don't want to go outside, and I'm the first to admit, I didn't let I was living in New Jersey for 25 years. I didn't let my kids out of the house because I was so scared. I have had Lyme disease 3 times. My son had it once. So, it was a serious problem. And, people are afraid to let their kids out. So, but being outside in nature is important for mental and physical health. So we've got this real conundrum here moving forward of how do we live in a sustainable, healthy way as the climate warms and the disease spreads and worsens. And meanwhile, we've set up the perfect conditions for making it for it just continuing to get worse.
So one answer of what can be done, Noah, is education. There are ways to go outside, but take precautions to be safe. I live on 40 acres in North Carolina. I go outside, I just tuck my pants in my socks, I spray my legs, I walk on paths that don't have a lot of brush rubbing against me, and I haven't had a tick in years. So there are ways to go outside, but it takes education. And that it takes us teaching our children and our parents how to keep their children safe. And so that education is a huge answer. If you don't mind, could you read the first part of that question again? So make sure we've kind of hit on some of it.
Yeah, I think and a very simple answer to this question, at least the first part, which is what is the current and expected evolution of prevalence, geographical spread, and impact of ticks and tick-borne disease, is that clearly based on both of your presentations, is it's likely to increase over the near future unless there are significant changes made in our approaches to development that are sustainable and focus on environmental protection, communication between the existing organizations, be it federal, state, doctor offices, etc. It will continue to increase, unfortunately.
Yeah, that's right.
And then the second part focuses on the improvement of management, testing, diagnosis, and treatment of these diseases amongst the patient and animal populations.
I would argue, dogs get tested annually. It's just part of the routine screening. I think in the hyper-endemic regions, it makes sense to just routinely screen people for Lyme disease. It just makes sense, the tests aren't great, and hopefully we can develop better ones. But at the same time, given the prevalence in the area, it would make sense to do routine screening for people to see if they harbor that and other tick-borne pathogens. I mean, there's a whole, one tick can spread a lot of diseases. So, you just kind of the routine battery of tick-borne diseases in a routine screening to see if you're harboring something, I think would make sense in a high endemic area. And in the parts of the country that we see that dogs are getting it, the physician should be aware that it is in the area. It's not something that to be dismissed because the human cases haven't been reported.
My concern is,
go ahead, Cheryl.
Sorry, my concern is that this information has been brought forward for over 10 years now. And here we are still wondering what to do to make it mainstream thinking. So patients can have a role here too. Now that some of the people on this call are aware that these Companion Animal Parasite Council maps are open to the public, you'll be able to use the link on my slides. They can actually go and take information from that to their physician just to get Lyme into his thoughts if it hasn't been. And same thing for the physicians. They can use these maps also. But the critical thing is, how do we make this mainstream thinking? And that's what our One Health, a whole movement has been struggling with, is how do we get general public, lawmakers, policymakers, physicians, veterinarians to get us to all understand this and to figure out what they can do about it. So the simple thing of asking the question on patient intake can, at least give, flag that, put that in front of mind for the physician. If he notices, well, this person is a veterinarian, and as it turns out, Bartonella is veterinarians are at true occupational health risk for a number of diseases, especially Bartonella. So just paying attention to, in fact, Hippocrates once said, it's better to know what kind of person has a disease than what kind of disease a person has. In other words, the environment, the life that the person is living can tell you so much about figuring out what disease you need to be thinking about for each individual patient before you.
So I know we have a couple of questions in from the audience. So just based on time, I want to get to a couple of those. The first is from Amy. I saw, it looks like, Laura, you just answered one as well from writing in, but this one I'll ask because I think it's relevant to the entire presentation. What federal and state frameworks need to be in place to better implement a One Health approach to complex issues like tick-borne disease?
Well, public health is really a state and local responsibility, so that's where the rubber hits the road. So it really needs to be at a state-by-state basis. And I know New Jersey passed a One Health task force bill that required greater interaction between the departments of health and agriculture and the environment. So that's one step forward, just trying to integrate cross-departmental efforts. These departments typically don't talk to each other. But as we see with Lyme disease, it's absolutely mandatory. The Department of Fish and Wildlife needs to talk to health, needs to talk to ag. They're all interconnected. We can't just focus strictly on the human, or we're getting a tiny part of the picture. These zoonotic and vector-borne diseases are extremely complex. It requires a One Health approach.
So Noah, what we really have to make this the default way of doing business is both a top-down and a bottom-up. And Laura's right, the states are in charge of public health. But if we can get the general public to understand, they can help lawmakers and policymakers understand. And we need structures at the federal level also that allow our agencies to work together. And we've been working on that, and it's, there's a framework for One Health that's been brought forward by CDC, and there's been some bills like the One Health Security Act that was presented to Congress. So you can't put all your eggs in the basket of the federal level, and you can't necessarily put all your eggs in the basket of the local level. We need them both. So I hope that we can continue to work that toward both. And a lot of that starts with education.
Education is a great segue to one of our other questions here, and I think a good opportunity to plug a lot of what Project Lyme does as an organization. We have a question from Elizabeth stating, how can we educate physicians about signs and symptoms of tick-borne disease? So this actually pairs really well with the second half of the question that was submitted by Cambridge, which are strategies to improve management, testing, diagnosis, and treatment. All of these things fall under the line of what Project Lyme is actively doing as an organization. In regard to the doctor education, we sponsored grants to send doctors to the ILADS conference, which is International Lyme and Associated Diseases Society. They have really robust educational programs directed at physicians at any state within, Lyme literacy, whether they are non-existent, have never seen a patient that has Lyme before, or haven't realized that they've seen a patient with Lyme, or have been treating Lyme for years. We actually actively sponsor doctors to attend that event and underwrite part of the cost. So that's one way that we're trying to educate physicians. And then on the patient-facing side, there's a lot of education that goes on as well. We have really in-depth resources on our website, a lot of social media, public service announcement campaigns that go on TV. These type of webinars are all ways to interact with patients and providers that are in the space looking to learn more and be better equipped to help prevent disease, not only with themselves, but within other people. And then the last thing I'll mention is the diagnosis and treatment. Outside of educational webinars, which we've done with several other groups, being diagnostic companies, researchers in the space, all of which you can find on our website, Project Lyme does also actively fund research projects in the space of diagnostics and treatment. We've had some recent advancements with things like nanotraps that focus on urine collection versus the typical PCR testing that has seen some increase in success. But obviously, as Laura mentioned, there's still more that needs to be done. So as an organization, we're going to continue funding that type of research. But I just wanted to let everybody know who is attending tonight that there is Project Lyme and other groups out there that are actively funding work that hopefully will eliminate that as one of the multitude of issues that are facing the patient population at the moment.
It's really hard to believe that this is 2024 and we still don't have a good way to diagnose acute Lyme disease. I mean, we're getting there, but we're not there yet. The other thing I just want to mention, and I'm sure Project Lyme is aware of it, is the organization Invisible International is providing continuing medical education free for health professionals to make themselves more aware of diseases like Lyme that really are kind of invisible. So if your audience is not aware, they're freely open. You don't have to be a physician to go and partake of those educational little lectures. I know I've got one there. So
yeah, I answered that. I put Invisible International.
Oh, good. I'm not in the chat box right now.
Invisible International is an amazing organization. We have partnered with them before, and we are hoping to develop some and help sponsor some creation of new CME courses for the organization, because I agree, any of that free education is super helpful in allowing doctors to, at least in the face of not 100% accurate tests, make a clinical diagnosis as well. That's something, to Laura's point earlier, if we had annual screenings kind of built into a patient process, if you have a doctor that's at least knowledgeable about the symptom presentations, they can help move the patient in the right direction, where maybe if they are just like, oh, I'm feeling a little down today, they might not go in. But if it's an annual requirement, then there's a more likely chance that they can get caught and ideally avoid super long-term chronic issues.
So Laura, that's probably going to fall in the same category as getting the question on the patient intake about, do you work with animals or do you live around animals? So getting that to happen in the medical community is just, I have no idea how you go about it. And that's where we're stuck right now.
Yeah, well, that's why I was arguing for just routine testing for, the battery of tick-borne pathogens.
Right, but how do you get that to happen? That's
Oh, that's a great question. Well, patient demand, perhaps. I think it requires a ground-up swelling of demand by the population that say, this is what we want, and this is what we're going to get. So it's a political issue that requires a political response.
Amazing. Well, that is actually, well, I guess the last one was from Bruce Fries. He had asked if April was still celebrated as Prevent Lyme Disease in Dogs Month. I'm not sure, Bruce, Cheryl or Laura, do you know? I'm not 100% sure either.
I don't know, but I do know that May is Lyme Awareness Month for people. So we're doing this.
Yes, it is.
Timely. So it's appropriate today.
Yes, this was definitely very appropriate. I wanted to at least open it up for one more second for Cheryl or Laura, if there's anything else that you wanted to convey to our audience, just to wrap up the conversation today.
Well, I'm delighted that this organization is committed to trying to reduce Lyme disease, other tick-borne diseases that are hyper endemic in certain parts of this country. Anyway, I mean, this is a global issue. And unfortunately, we should anticipate them spreading as the climate changes. So it's not going away, but as Cheryl said, education, awareness will go a long way. And again, advocacy, patient advocacy, notifying your representative in Congress that these are important issues would certainly help.
Amazing. Thank you both.
I just want to remind everyone that those maps, I don't know, can you hear me? Those Cap C, Companion Animal Parasite Council maps, as well as the CDC maps, they're continually updated. So, I mean, for the Cap C, for the animal ones, they have already posted through 2023. CDC's only posted through 2022, but the patients can go in and look at those. That's open to the public. So that can arm patients with information that they need when they're making their demands to their lawmakers and their physicians.
And the last question, looks like it just came in, and it's a perfect way to wrap up. Yes, this is being recorded. It will be available on Project Lyme's YouTube and webinars page on our website as early as tomorrow morning. I'll share the link with Cheryl and Laura if they would like to get it up to their websites as well. So this will be openly available. We want this information to be reviewed and shared as widely as possible, because I think, as we've addressed already, that knowledge is what's going to really help arm people to take next steps to fight the system that is existing currently. So thank you again, Cheryl and Laura, for your contribution this evening. It's been a pleasure partnering with both of your organizations. Hopefully we can do something again, because I think, to both of your points, there's so many in-depth issues that can be covered as a result of One Health. So wishing you both a great rest of your evening, and everybody keep an eye out for the link tomorrow morning.
Thank you so much, Noah. It was a pleasure.
Thanks. Bye-bye.
Bye, Cheryl. Bye, Laura.